We'll see if I can get through this without the camera turning off and the autofocus doing its job. How am I feeling currently? Today has been great so far. I've only been awake for about an hour, so that's probably why. So the question that everyone asks, how did this all start? Finn! If the light keeps adjusting, it's because Finn keeps running through all the blinds. So the first question I always get, how did this all begin? Almost immediately following my second round of PT after knee surgery, I started to realize that if I laid on my stomach or bent over for long periods of time, that my head would begin to fill with immense pressure, my ears would clog, I would get tinnitus, and then I would start to black out. But of course, I gaslit myself into thinking, no, this is normal, I'm totally fine. I believe it was actually December 27th of 2020, so that's Finn, sorry. We'll just call it beginning of 2021 because it was end of December, beginning of January, that weekend. He is just having a time. So it's like 8 p.m. on a Thursday night, Spencer's at work, and I start having an episode that resembles exactly what a heart attack is like. I decide to wait it out because I'm like, you know what, if I go to the ER right now, it's probably only going to stress me out more considering the medical malpractice that I've experienced in the past. I really didn't want to push it. The next day I go in, I explain what happened, and I explain my symptoms leading up to this, and I'm told that I have panic attacks and extreme anxiety and that I should just see a psychiatrist and that I'm fine and I'm young. So I go to my primary care physician with this information. We start tracking my blood pressure and my heart rate, and totally abnormal. My systolic's doing this, my diastolic's doing this, then they go like this, and then tachycardia out the woozah. So I get a referral for cardiology, wear a heart monitor, it's a whole thing. They're like, oh, you have arrhythmias every time these episodes happen. I'm like, cool, not cool. What do we do about that? They send me to electrophysiology. So then I'm in electrophysiology. We go to do a tilt table. They try to stick me for the injection before the tilt table. My veins explode. Turns into a whole 3-hour debacle of how we're gonna do this. Editing alley here. I think it's important to note that 3 hours was not spent on trying to figure out how we were going to do the tilt table. About 20 minutes was trying to figure that out. The other 2 hours and 40 minutes was whenever my veins blow from something like that, one of the episodes is triggered, and then I am in and out of consciousness. I can't see, I can't walk, I can barely talk. My blood pressure skyrockets. It's so bad. End up doing the tilt table without any injection or anything, and then so my hands and feet start tingling. I have peripheral neuropathy during and after the tilt table test, and they say that's not normal, but you also tested negative because that's not what we're looking for. Thought it was POTS for a really long time. Heavily considered EDS. So once I go to electrophysiology, basically I get prescribed metoprolol to help with the tachycardia and get sent on my way. I ask for a referral to neurology, which I don't receive. Fast forward to September, I have another terrible episode, and I'm talking textbook stroke. I go into this staring tunnel vision phase. My speech is slurred. This side of my face, tingly. This side of my body, complete muscle weakness. I have trouble standing, and it is just, I'm having vision loss on and off, hearing loss on and off. I start yelling at Spencer to call 911. It's 12 o'clock in the morning. So the first responders finally get here and they're like, oh, you're young, you're fine. There was even joking about my age, which was a whole thing. And, I was just kind of okay, I'm you seem more excited to see my cats than you are to help me with this. They basically say, you had an anxiety attack, you're fine. I'm no, it wasn't. I start going into my medical history. I pull out all the prescriptions that I've had to be on for other health issues. And I'm like, could any of these have had an interaction with one another? I went on several different websites to check the interactions, and this could have a mild interaction with this could do that. I'm like, can we please look into this further? And then they start taking it seriously. Then they get out all this equipment to start running tests. And everything comes back mainly normal. The main guy heavily insisted that I go to the hospital, and I said, I don't have the money for that, but thank you. Finally get the referral to follow up with neurology following that event because of the serious symptoms that I experienced. And they send me to the stroke specialist, who then refers me for an MRI and MRA of the brain and neck, both with and without contrast. Now, I had already had an MRI of the brain without contrast back in November. Keep this in mind. Those come back. She says that they're totally fine. All I have is the right sinus maxillary retention cyst, and that's the only thing that they can see. I finally get into the neurologist. I sit down, they get all my symptoms again. She comes in and immediately goes, I think I know what's wrong, and I think I finally have your answers. I say, thank you, what is it? She pulls out the MRI, and there is a lesion in the middle of my brain. Turns out you could see it back on my MRI from November, and it was also missed then. I could have known about this like half a year ago and dealt with it. So anyways, I wait for the call about a week later. So at this point, this is like 5 days ago now. I get the call from the head of her office, and the radiologist has looked over it again. He calls and he's like, do you understand what's going on here? We're giving you the referral to neurosurgery, but do you understand what's happening? And I was like, oh yeah, I have a cyst. And he was like, well, we're not entirely sure it's a cyst. Usually at the size yours is at, they're asymptomatic, but because it's not, it could be more likely that it's a tumor, and it is also sitting on top of your cerebral aqueduct, which allows CSF fluid to travel, which is cerebrospinal fluid, which is, shocker, if that gets blocked, not good, could be fatal. So then, even before that phone call, by about 2 days, I am sent into the spiral of how do I find a neurosurgeon who specializes in this surgery? What are the complications? What are the risks and the benefits? Like, do I need to have this done? The answer is yes, I do. But the main side effect that I keep seeing is visual loss and disturbance. And anyone who knows me, IRL, knows that I am heavily reliant on my vision for everything I do in my life, including previous jobs, what I do for hobbies, the cats that try to kill themselves every day that I have to check everything for constantly like they are toddlers. We're gonna be moving soon. There's so much that I just cannot have any visual disturbances for. So I'm researching all of this stuff, and the main name that comes up is Dr. Patel. Mind you, trust me, I've researched a lot of surgeons, and I'm consulting more than one, so don't you worry now. Because where the lesion is so close to the ocular nerves that's why this is a main risk. And everyone says you're not supposed to use screens 2 weeks after surgery for your nerves to heal, and it's gonna be a whole time, but you're going to come along with me so you can see the entire time. Yeah, I'm sorry. My eyes are like starting to hurt just filming this. Like, if I could just go like this for the rest of the day with a heating pad and ice pack rotating on my head, that would be superb. But yeah, I am so positive that there are so many more details that I could get into, like almost, you know, having a seizure because of strobe lights at the Måneskin show we went to, and how I flew with it, and you're not supposed to fly when you have something like that, but I didn't know about it and I flew anyways and felt like shit for about 2 weeks after, and how I'm pretty sure that I had, you know, spinal fluid just drain from my nose profusely while I was eating a sandwich because I suddenly tasted chemicals and was like, I don't think that's right. So if you want to drop questions in the comments, maybe I'll do like a Q&A sort of video eventually. But for now, there's all of the information I felt like I should give you for you to kind of understand why my life has been taken away from me for the past 2 years, other than a few days where I can do nice things. I will leave the GoFundMe link in the description for all the lodging and medical bills and whatnot. Getting my GoFundMe ready so I can go see the big whale shark in case I go blind. We've already met our goal for me to go to the aquarium, so that's fucking sick. And I will see you guys next time.